Hello everyone, I'm Dr. Sarita Jain. In today's video, I'm going to discuss about the role of magnesium sulfate for the neuroprotection in preterm labor. So what are the indications for magnesium sulfate? It is primarily used to reduce the risk of cerebral palsy and other neurological complication in very preterm infants, that is those born before 32 weeks of gestation. It can be used for the preterm labor prevention as a tocolytic agent to delay preterm labor, though it is not usually the first line treatment. For the neuroprotection, it is administered intravenously as a loading dose of 4 to 6 gram over 15 to 30 minutes, followed by a continuous infusion of 1 to 2 gram per hour for up to 24 hours. And for the prevention of preterm labor, it is administered IV with an initial bolus of 4 to 6 gram over 20 to 30 minutes, followed by a maintenance dose of 1 to 2 gram per hour. It is contraindicated in severe renal impairment because it is excreted through the kidney. So in case of severe renal dysfunction, there is risk of toxicity. It is also contraindicated in myasthenia gravis patients because it can worsen the muscle weakness. Caution is required in hypocalcemia as magnesium sulfate can exacerbate low calcium levels. There are certain drug interaction also with magnesium sulfate. Both magnesium sulfate and beta agonist, that is terbutaline, can cause cardiovascular side effects. When used together, monitor for signs of tachycardia and hypotension. Magnesium sulfate, if combined with calcium channel blockers, they may increase the risk of hypotension and cardiac issues. So monitoring is necessary. NSAIDs like indomethacin with the magnesium sulfate is generally avoided due to increased risk of adverse effects such as renal impairment and gastrointestinal issues. Indomethacin can also cause decreased amniotic fluid and premature closure of the ductus arteriosus in the fetus. Magnesium sulfate can enhance the effect of muscle relaxant, increasing the risk of neuromuscular blockade. So what are the benefits of magnesium sulfate? It is effective in reducing the incidence of cerebral palsy and improving the neurological outcome in preterm infants. It can delay delivery, providing the time for administration of corticosteroids like betamethasone to enhance the fetal lung maturity. Regular monitoring for serum magnesium levels, renal function and vital signs to prevent toxicity is required. Symptoms of magnesium toxicity include loss of deep tendon reflexes, respiratory depression and altered mental status. Keep ready calcium gluconate because it is an antidote for magnesium toxicity. So in summary, magnesium sulfate is the standard for neuroprotection in preterm infants and can be used for preterm labor prevention. It should be used cautiously in conjunction with other medication due to potential interaction and side effects. Careful monitoring and appropriate management are essential for optimal outcome. So this was all about use of magnesium sulfate for neuroprotection in preterm labor. If you found this video useful, please like and share the video and subscribe my channel. Thank you.